Hi everyone, thank you for joining us today. You are watching the Equal Hope segment on CAN TV. My name is Leilani Laxon Soltesiak, and I'm very happy that you can join us. For those of you who are not familiar with Equal Hope, we are a nonprofit organization in Chicago whose mission is to eliminate health disparities. We do this by offering free services such as free cervical cancer screenings, free mammograms, linking to a primary care provider, PCP, for free. We also assist with getting different types of vaccinations like the HPV vaccine, COVID-19 vaccine, and the flu shot. And we offer many other services. Give us a call today at 312-942-3368, or you can visit us at equalhope.org. We have social media accounts that you can follow. We have Twitter, Facebook, TikTok, and Instagram. Also, we have cancer support resources on equalhope.org for cancer patients, caregivers, and providers, so you should check us out today. Let me introduce this month's guest, Dr. Madeline Perry. She is a third-year OBGYN resident at Northwestern and Stroger Hospitals. Dr. Perry, thank you for joining us this month.
Thank you so much for having me. I'm looking forward to talking with you today.
Great. January is Cervical Cancer Awareness Month, and today Dr. Perry will be telling us more about cervical cancer. So just a little background before we get into discussion. Cervical cancer is cancer that starts in the cells of the cervix, the lower part of the uterus that connects to the vagina. Each year in the United States, about 13,000 new cases of cervical cancer are diagnosed, and about 4,000 women die of this cancer. Although the number of new cases has been declining over the past few decades, thanks to the Pap screening, cervical cancer is still the second most common type of cancer for women worldwide. Women of all ages are at risk for cervical cancer. Hispanic women have the highest rates of developing cervical cancer, and Black women have the highest rates of dying from cervical cancer. Okay, let's jump into the discussion. Dr. Perry, tell us about yourself and how you got into the medical field.
Yeah, a little bit about myself. I am originally from Cincinnati, Ohio, and I've been living in Chicago since I started my residency in obstetrics and gynecology. I ultimately got interested in medicine for a number of different reasons throughout my life. But I found that something that I think continues to be at the beginning of this story is that I've always been interested in and had a passion for access to healthcare. I've always been interested in healthcare outcomes and why some people ultimately are sicker than other people. And I ultimately got interested in medicine because I wanted to be able to address healthcare inequities and issues related to access to healthcare on an individual level by taking care of patients. And ultimately, as I've continued to study healthcare, public health, and work in this field, I've also become more interested and more involved in thinking about how the structural issues that make it hard for some people to access healthcare, um, how we can start to solve those problems. And then within healthcare and medicine, what I've always been interested in is women's health. I have a passion for taking care of people with with female reproductive organs, doing research in that field and doing advocacy in that field. And I think that's mainly how I've ended up as an OBGYN resident right now.
Great, great. For those of you who listen to our radio show on WVON, Dr. Perry was a guest a few months back. It was around the time Roe versus Wade was overturned. So, as I said earlier, January is Cervical Cancer Awareness Month. Dr. Perry, what are the signs and symptoms of cervical cancer?
So that's a really great question. The interesting thing is that early cervical cancer generally is actually asymptomatic, meaning that people don't have any symptoms. And this is why screening is so important, because for a lot of people who have early cervical cancer, there's nothing that will clue them into something going wrong. When people do have symptoms related to cervical cancer, it most often includes vaginal bleeding. So that can include having irregular periods, having heavier periods or heavier bleeding, having bleeding after intercourse, and then for people who have gone through menopause, having bleeding after menopause.
So, what is a woman's chance for developing this cancer?
So cervical cancer, about almost all cervical cancers, or about 99.7% of cervical cancers, are associated with a human papillomavirus. That's something that you'll hear me and a lot of other people refer to as HPV. So, something that very largely increases people's risk of developing cervical cancer is having HPV or contracting the human papillomavirus. Things that decrease people's risk of having cervical cancer include things like getting the HPV vaccine and also getting regular cervical cancer screening.
Okay.
Other things that can also sometimes increase the risk of people developing cervical cancer can be things like smoking cigarettes. And that's because cigarette smoke can make it harder for people's bodies to like clear the human papillomavirus.
Mhm.
And then people who also have baseline suppressed immune systems, so people with certain autoimmune conditions who are taking immune suppressing medicines, or people living with HIV can also be at an increased risk for developing cervical cancer.
What are the chances of developing cervical cancer if you do have HPV?
It all kind of depends.
Mhm.
So just having HPV found on one of your cervical cancer screenings does not mean that you're ultimately going to develop cervical cancer. And for the large majority of people who have HPV, some people will just automatically, their body will fight off that virus on their own without having to have any sort of treatment. Other people might need a sort of minor type of treatment, but for the large majority of people who have HPV on their cervix, with regular follow ups and check ins with their doctor, people will not ultimately develop cancer.
Sounds promising.
Yeah, it is.
What are the current guidelines for cervical cancer screening?
Yeah, so this is a really good question, and kind of the short answer is that it depends on your age and it also depends on what your most recent cervical cancer screening was. I think before getting into that answer, I think it's helpful to know the two different types of tests that we do for cervical cancer screening. So the first is a test that I think a lot of people are familiar with. It's called the pap smear. And with that test, what we're doing is we're using usually like a small spatula or a brush and collecting some cells from the very outer surface of the cervix. And we're looking for abnormal cells. And specifically, what we're looking for with those cells is we're looking for cells that look like they could potentially turn into cancer down the line. So that's one type of test that we do for cervical cancer screening. The other type of test that we do for cervical cancer screening is HPV testing. And that's just a test where we look to see if the HPV virus can be found on cervical cells or not. If we do find HPV, then we'll usually look to find what's the specific type of HPV that is on the cervix, because there are certain types of the human papillomavirus that are a little bit more aggressive than other types. So, with that information in mind, we can talk about how cervical cancer screening usually works. For the large majority of people, cervical cancer screening will start when people are 21 years old. Usually from the age of 21 to 30 years old, people will oftentimes get cervical cancer screening every 3 years, and often they'll just get a pap smear. They won't get HPV testing. Once somebody turns 30 years old, at that point, we usually start doing both the pap smear and HPV testing. And when we use both of those tests together, we can actually wait 5 years in between doing testing. So people don't even need cervical cancer screening that often. And then once people get to about 65 years old, that's when we start to talk about potentially stopping cervical cancer screening. The exact answer for each individual person as to when we can stop cervical cancer screening, it ends up being a pretty individualized decision between a patient and their doctor. And it depends on things like if you've missed any pap smears in the past, if you've ever had an abnormal pap smear. But usually around the age of 65 is when we start to discuss that with patients.
So one question I have for you is you mentioned that women should start their screenings at 21. Does it matter if they're currently sexually active or not currently sexually active?
So for women who are sexually active at 21 years old, I would definitely recommend starting getting pap smears at that time.
Mm-hmm.
For women who aren't sexually active at 21 years old, I think it's a good idea to go ahead and see a gynecologist, and then that's a really good discussion to have with your primary gynecologist.
Okay. So walk us through a typical cervical cancer screening. There might be some women who haven't had a cervical cancer screening because they've heard stories from their friends about how uncomfortable or painful it is, or for people who are curious what a cervical cancer screening entails. Can you walk us through an exam?
Yes, I definitely can. I think even before walking through, I think one thing that's important to say is that if you are somebody who has female reproductive organs and you're somebody who should be getting pap smears, and if pap smears, just the idea of them, make you really uncomfortable and concerned, you can always let your healthcare provider know, because while I'm about to talk through the typical way that we do these things, there are a lot of different ways that we can help make people more comfortable. And we recognize that this is not something that is comfortable. Not many people look forward to getting a pap smear. And that's something that we know, and we are ready and able to help people who feel like they need a little bit more help to make it more comfortable for them. So to kind of go through what a normal cervical cancer screening might look like, the first thing is that it involves going to a healthcare provider. All obstetricians and gynecologists are able to do a pap smear. There's also a number of primary care providers, including nurse practitioners, physician's assistants, family medicine doctors, internal medicine doctors, who are able to do cervical cancer screening. So usually you'll go ahead and talk with a doctor for a period of time, or another healthcare provider, review past cervical cancer screening, and then usually after that, you'll go ahead and get ready for a speculum exam. So a speculum exam involves using a small device to help open up the walls of the vagina, just so that your healthcare provider can see the cervix. This involves usually just getting undressed from the waist down and then placing the speculum in the vagina. Once the healthcare provider is able to visualize the cervix, which usually doesn't take a ton of time to actually visualize the cervix, it should only take a couple of seconds. So once the healthcare provider is able to visualize the cervix, we use two different types of basically swabs to collect some cells from the very exterior of the cervix. The first one of these kind of looks like a spatula, something that's smooth, and it just helps to collect a couple of cells. And then the next type of swab that we use is a small brush. Overall, when people have cervical cancer screening, the main thing that they'll probably feel is some pressure in the vagina and maybe a little bit of pressure on the cervix. Things that people shouldn't feel is you shouldn't feel sharp pain. You shouldn't really feel like anyone's poking you. Those are things that are not common to feel. After having your cervical cancer screening, it's not uncommon to have a little bit of vaginal spotting. That's something that can happen, and that should stop within a day or so. And then the swabs that were used to collect some cells from the cervix, those will be swirled around in a little cup of water and then sent to a lab. It usually takes most doctors' offices, most hospitals, facilities, etc., about a week, sometimes even 2 weeks, to get the results of the cervical cancer screening back. And then at that time, you'll usually get a message from your healthcare provider with the results of your cervical cancer screening and if there's any next steps that you need to take.
How long do these exams usually take?
It overall sometimes depends, but I would say from start to finish, they should take probably less than 5 minutes.
Okay, so that's really quick and easy.
Exactly. It's really quick and easy, and the people who perform these exams usually do a lot of them. So it's something that we have little tips and tricks to help people, especially if vaginal and speculum exams are uncomfortable. And we know that there's a number of people for whom these are uncomfortable. So we have ways to make it a little bit easier for people too.
Okay, great. So one of my questions you actually had just answered, who can
Mhm.
perform this procedure? And even your regular doctor can do it in office?
Exactly, exactly. So OBGYNs definitely can do it. The majority of family medicine physicians are able to do it. Nurse practitioners, especially those who focus in women's health or primary care, and then internal medicine doctors. So it's always a good idea. You can always ask the doctor that you're going to, if they're not a gynecologist, if they feel comfortable doing
Mm-hmm.
a cervical cancer screening.
Mm-hmm.
And if not, you can always find a gynecologist and you can go to them for your cervical cancer screening.
Great. So help us understand cervical cancer screening results. I know that, women or people who were scared in the first place to get screened may be nervous when they get the results, and then they might get so nervous they may not understand what the results are
Yeah.
telling them. So if someone gets a pap that came back normal, what does that mean?
So a pap smear that comes back as normal means that we don't see any abnormal cells or any cells that we think might ultimately develop into precancer or cancer. I think when talking about the results of pap smears, it can be helpful to go over some of the terminology that you might see. Um, so when we're doing pap smears, we're looking at basically types of cells that are called epithelial cells. And when you look at your pap smear results, there's a good chance that you're going to see a phrase called intraepithelial lesion. And this is just medical terminology that we use to say that we're looking for abnormalities in the epithelial cells. So if you have a normal pap smear, you'll see something called negative for intraepithelial lesions. And that just means that there are no abnormal cells on your pap smear. Um, to take a step back, right now, I'm just describing the pap smear. When we look at the results from a pap smear, we look at both the pap smear, so the cells, and then whether or not people have HPV if that testing was done. So we went over a normal pap smear. There's a couple of different types of ways that the cells on a pap smear can be abnormal. So the first type of way that this can happen is something called low-grade squamous intraepithelial lesion. This generally means that there's some abnormalities of the cells within the pap smear that are related to HPV, but the likelihood that these develop into cancer is lower. The next type of abnormality you can have is something called high-grade squamous intraepithelial lesions. This generally means that there are precancerous cells on the cervix. And then the last type of abnormal cells that you can have through a pap smear is called atypical squamous cells of unknown significance. All this means is that the cells on the cervix look a little bit abnormal, but we're not entirely sure if it's because they could develop into cancer or if they look abnormal for a different reason. So those are the different results of the pap smear. For HPV testing, basically you kind of have a yes or no answer to that. So you either do have HPV or you don't. If you do have HPV, then we'll oftentimes look for the exact type or the strain of HPV that you have. And then ultimately what we do is we put together both of the results to both of those tests, so to the pap smear and to the HPV testing. And with that, we make our decision on what the next step is going to be.
Okay. I was going to ask you what the next steps are. If, something comes back normal, something suspicious, HPV test comes out positive.
Yeah, so ultimately, there are a number of different algorithms that we use to determine the exact next step. But I think, kind of to generalize a couple things, if your pap smear is normal and if you don't have HPV, then it's most likely that you're going to be able to wait either 3 to 5 years, depending on your age, until you have to do another set of cervical cancer screening. If you have an abnormality on the pap smear, so if any of the cells are abnormal, there's a good chance that we're going to recommend doing a small biopsy of the cervix. That's something that's called colposcopy. Similarly, if HPV is detected on the pap smear, there's also a chance that you might need a biopsy of your cervix, again, called colposcopy. Depending on the exact changes in the cells and the exact type of the human papillomavirus that we see on PAPs on cervical cancer screening, there's a chance that we might just recommend that you get another set of cervical cancer screening at a shorter interval. But I think generally, I think a good generalization is that if you have an abnormality on your cervical cancer screening, there's a chance that your healthcare provider is going to recommend doing a biopsy of your cervix.
Okay. There is a vaccine out there called the HPV vaccine, and we have about 5 minutes left. Tell us about
Okay.
this HPV vaccine and its link to cervical cancer.
Yeah, so the HPV vaccine is, in my opinion, one of the best vaccines that we have. So the HPV vaccine helps prevent people from getting infected with a human papillomavirus. We know that the human papillomavirus is one of the biggest causes of cervical cancer. So by getting this vaccine, you're helping to reduce your risk of getting HPV and therefore and therefore developing cervical cancer. The HPV vaccine is something that we actually recommend that kids get. It works best if you get the vaccine before you've ever been exposed to the human papillomavirus. So the current CDC recommendations are that both boys and girls ages 11 to 12 get 2 doses of the HPV vaccine. If you are older than 11 to 12 years old, but younger than 27 years old, so if you're up to 26 years old, we still recommend that you get the HPV vaccine. For people who are older than 26 years old, I think it's always a good idea to talk to your doctor. You might be somebody who would benefit from getting the vaccine if you haven't already gotten it. We know that the HPV vaccine is incredibly safe. Really, the only major side effects that people get from this vaccine is they might get a bit of soreness on their arm where they get the injection. But the HPV vaccine, in my opinion, is one of the best steps that people can take to reduce the risk of getting cervical cancer.
And is it 1 or 2 shots?
So it depends on your age. If you are 11 to 12 years old, it's only 2 shots. If you are older than 14 years old, we usually recommend that people get 3 shots.
Okay. So we have about 3 minutes left. So let's wrap up on this discussion about cervical cancer awareness. How can women get started with finding an OBGYN?
Yeah, that's a really good question. So there's a couple recommendations that I give people when they're trying to find a healthcare provider who can provide cervical cancer screening. The first is that I think it's important that healthcare providers are easy to access. So maybe consider going to a clinic that is close to either where you live, where you work, or where you study. Next, I think it can be really helpful to go to a healthcare provider who is either recommended by somebody you trust, like a family or a friend, or someone who you know through other connections. And that's because cervical cancer screening involves sensitive exams. And so if you feel like you're already going into the appointment with somebody who you trust, I think it can make the experience a little bit easier for people. And then finally, if you feel like you actually you don't have too many connections in the Chicago area and you're looking for a place to ultimately establish your gynecologic care, something that I usually recommend is looking at the academic institutions in a city. So places like Northwestern or UIC or Stroger. And that's because these are hospital systems and academic systems that have a lot of healthcare providers who are able to see patients.
Great. So a little over a minute left. Tell us why women should get screened.
So cervical cancer, in my opinion, shouldn't happen. People should not get sick, should not die from cervical cancer. And that's because we can basically prevent the majority of cervical cancers. We can prevent them with the HPV vaccine and cervical cancer screening. So I think it's so important because I don't want anyone to experience cervical cancer. And I think this is something that we can almost make non-existent with the appropriate screening and with making sure that people have access to the vaccine. So I'm such a strong believer in cervical cancer screening. I'm a huge advocate for it. And I think that everyone who has female reproductive organs should strongly consider cervical cancer screening and reach out to a healthcare provider to help get started.
Great. Well, Dr. Perry, I'd like to thank you for joining us tonight and also being a guest again for this time for our TV show.
Thank you so much for having me. I'm so happy to be able to come back and be a guest again.
Great. So tune in next time, guys, February 28th from 5 to 5:25 p.m. Thank you and good night, everyone.